Hello, I'm James Jackson, Chief Executive Officer of the Alameda Health System. As many of you may know, Congress passed H.R. 1, or as we call it, the Big Bill. As the CEO of a healthcare system that serves Alameda County's most vulnerable patients, I am profoundly concerned about the Big Bill's impact on our communities. Not only does the Big Bill cut millions of dollars from our healthcare system, it also puts thousands of our patients at risk of losing healthcare coverage due to new burdensome verification and eligibility requirements. These are patients with complex, multifaceted health conditions that will be left at the mercy of very stressed systems, delaying care and reducing resources that cannot fully meet their needs. Getting sick or injured is inevitable, and we know many of our patients will be forced to delay care and eventually end up in emergency rooms that are already overwhelmed. As a result, our community will come to the ED sicker and utilize the most expensive way to treat patients. To learn more about how the Big Bill will impact the Alameda Health System, we talked to John Minot-Schwartz, Director of Reimbursement and Finance Strategy. Let's hear what he had to say.
Between 2.3 million and 3.5 million Californians are at risk of losing Medi-Cal due to the Big Bill. AHS expects financial impacts that could be in the ballpark of $50 million a year in 2027 and $100 million a year or more by 2030. There is a possibility of more cuts at the state level because the state really depends on federal funds to pay for Medi-Cal as it stands now. Staff should know that first, their patients could be facing new hurdles to getting and maintaining Medi-Cal. Many patients will have to submit a lot more information a lot more frequently. It's already not an easy process to get and keep Medi-Cal, but it would become much harder having to prove that you are working or studying 80 hours a month or else lose Medi-Cal unless you fall into one of some exemptions. So a lot of people would be working but would still not be able to jump through the hoops to show that they are working to the satisfaction of the program. Patients should know that if they or their loved ones depend on Medi-Cal coverage, that they should be on the lookout for information on how to keep their Medi-Cal over the next 18 months. AHS is doing everything it can to keep these cuts from becoming a reality, and concerned citizens can help by contacting their congressional representative and telling them that we need to maintain our health care. We are still learning more about the bill's impact and understanding it. Our estimates are always being refined, and we are trying to get out as much information as we can about how it's going to impact us and how it's going to impact patients. The picture is always getting clearer.
As you've just heard, the stakes have never been higher. Millions of Californians may lose access to care, and we cannot remain idle. The Alameda Health System will continue to advocate relentlessly and strategically at the local, state, and the federal levels to protect our funding and to compel our congressional delegation to stand up for our patients and fight for the health care they deserve. In addition, we will continue to care for everyone who comes through our doors, regardless of their ability to pay, as required by the Emergency Medical Treatment and Labor Act, also known as EMTALA, and by our mission of caring, healing, teaching, and serving all. Our team's dedication, compassion, and commitment to patients are what sets the Alameda Health System apart. We're proud to provide genuine care because we are real people, real care. Not just health care, people care.